They know, yeah. Exactly.
No, I took a walk.
And Ross is on our board. Oh, Julie, yeah. Yeah, yeah. I love her. She actually really helps me think like career stuff.
She's kind of so we kind of are fresh, yeah, started talking. It's just, I love that. Yeah, we miss her in Bible.
Yeah. We have a 6:15 a.m. on started for women who work and not yoga.
Oh, wow.
No, she's very big. I'd love to talk about her.
Yeah. Okay.
All right. Great.
How was your week?
Good evening, everybody. So if you're like me and are vain, you don't want anybody to know that you wear hearing aids. But if you wear a mask and you try to take the mask off, the hearing aids pop out of your ears. And so I'm stuck here in front of you and on YouTube and Facebook with my hearing aids popping out of my ears. So there goes my vanity out the window. And I'm not trying to be unfriendly with my mask, but you know, if you ever go to a nursing home or a hospital, those sorts of places, they say, have you been near somebody that had COVID in the last certain amount of time? And it so happens that I was near somebody who had COVID. So I'm being careful tonight, not being unfriendly, but I may not be hugging everybody afterwards at our reception. But we're so pleased to have you here tonight. And I lost my voice 2 weeks ago. I got it back for Sunday, and now I've lost it again. It has nothing to do with anything else that I'm talking about. Two wonderful words in the English language are sympathy and empathy. Sympathy means you really feel bad about what somebody else is going through. And that's a wonderful quality to have. Empathy is something deeper. Empathy is when you can actually look somebody in the eye and say, I know what you're going through. And that really was the beginning of what we refer to in our church as our Shalom ministry. Our Shalom ministry is really only a few months old. But as a result of families in our church, men and women in our church, young people in our church, who were going through the full range of mental health issues. There's not a single mental health issue you can name that somebody in our church hasn't been facing either themselves or in their family or with a loved one. And so we finally decided to gather all those people together and then out of our Shalom ministry, try to tap into those resources that we're fortunate to have in our area, in our community, in our state, and bring them here for all of us to gain from their wisdom. And tonight we're so pleased to have Shatterproof as an organization and Gary Mendell as a speaker who is going to be sharing with us from the depths of his own experience, the loss that he and his family and loved ones felt, the devastation that came when addiction hit their home and hit their family and took their son away. And they made that decision, which many families of goodwill have made when they've lost a loved one to such circumstances. They've made a decision that we don't want this death to be in vain. We want something good, something hopeful, something positive, something healing to come of it. And that's what you're going to hear about tonight in the work of Shatterproof. So tonight we are thinking about addiction in particular. And it got me thinking about my own journey. I'm looking out on the audience, and it looks like I'm about the oldest person here by 40 years. So I go back further than some of you. But I first became aware of things like addiction back in the early 50s when my father took me to the Bowery Mission. It's a famous place in the Lower East Side of Manhattan. And it was where people cared for, and the word in those days was bums. That was the word, bums. And you jump ahead all these years later, and all the words that have been in vogue. Somebody's the life of the party. Somebody is an occasional drinker. Somebody's a partier, a hard partier. Somebody's the life of the party. All of those kinds of phrases that we've had to sort of mask what was really going on as lives and families and hopes and dreams and health were being broken apart by one form of addiction or another. So that's what Gary's going to be sharing with us in terms of his own life's work now with Shatterproof. We're going to begin first with a video, and then Gary's going to come up and give his presentation, and then we'll have a time of question and answer. And we're so pleased to have back in our familiar pews the men of Pivot House. They were here in our church just 2 weeks ago. And for those who aren't familiar with Pivot House, that is a Christian-based alcohol and drug rehabilitation ministry, just probably 5 or 6 miles from our front door, and have been doing it for a long time, and doing it just beautifully, successfully, powerfully. And we consider it a privilege to partner with them in their precious work. And Gary actually spoke at Pivot at one of their early prayer breakfasts some years ago, one of their main outreach and fundraising prayer breakfasts. So the connection runs deep here. So let's have the video, and then Gary, you'll come up to the pulpit and be our guest preacher for the night.
Focusing much of our nation's energy on coronavirus, this is not the only health crisis we are battling. Unfortunately, across the nation, drug overdose deaths are rising among the coronavirus, negating much of the progress that we made over the last several years.
Dear Greg,
Michael Honey,
from the moment you were born, you were the sweetest kid.
you brought us such joy and happiness. Thank you for those 29 years.
We have a vision that our society will look this disease straight in the eye, prevent it and treat it with love and empathy, and with protocols based on science.
We are coming together to increase awareness and funding for the prevention, treatment, and recovery of this disease.
I'm repelling from my son Paul.
I'm repelling from my dad.
I'm repelling from my sister-in-law.
That was awesome! Go Shatterproof! Go Shatterproof!
We are here for friends. We are here for family. We are here for community. And we are here to bring the disease of addiction out of the darkness and into the light.
We are Shatterproof!
My oldest son, Brian, struggled with addiction for 8 years. And during that time, he went to 8 different treatment programs. Each one was different. After Brian's death, I was haunted. What could be done to spare other families from this tragedy?
Shatterproof is currently developing public databases in multiple states that, if successful, will allow the public to identify, evaluate, and compare substance use treatment programs.
I would like to extend my appreciation to President Bill Clinton, Chelsea Clinton, and their Health Matters initiative.
I'm very grateful to be here today at a critical time to talk about why we must tackle this issue and what Congress must do to tackle this issue.
We need to start treating people in this country, not jailing them. We need to give them the tools they need to recover, because every life is precious. Every life is an individual gift from God. And we have to stop judging and start giving them the tools they need to get better.
I don't think about this issue as a public official or as a healthcare guy. I think about it as a father. I've talked to people who've been in the middle of this, and they're among the grittiest and gutsiest people I've ever met. And they deserve our respect and our love and our support.
Let's create that world that Brian didn't see. Let's create that world for the next young man that comes along, the next young woman that comes along, the next family. Let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you.
Either go to the pulpit or give me a handheld mic, either one. Okay. Okay, yeah. Because we're taping as well.
Okay, great. So again, thank you all for being here. Really, really appreciate it. There's a lot I can tell you about everything we're doing, but I'd like to start with a personal story. And my story begins a few miles down the road here in Easton, where I was raising my family. The story is about 2 boys. They were both in high school, right here at Joel Barlow High School, and the year is 2004. The first, Mikey, was diagnosed with cancer. As you'd expect, his family was devastated. However, they were easily able to access the highest quality treatment, medical care for their son. Medical care that was all based on science, on research. Mikey's father and mother told their friends what Mikey was struggling with.
And our whole town, right here in Easton, right next door here, rallied behind Mikey and his family. Parents came to their home with cooked meals. They drove carpools. The kids in our elementary school held bake sales on the weekends for Mikey and his new charity for cancer research. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease can ever dream of. Empathy. Well, 2 streets away, Mikey's friend, my son Brian, was also struggling with a disease. But for Brian and our family, it was different. We looked for medical care for our son, but we couldn't find any that was based on science. I didn't tell too many of our friends about the disease my son was struggling with. To be honest, I was embarrassed. I was ashamed as a father for my son having this disease. And our community didn't rally behind us. No cooked meals, no carpools. But when I think back on those years, what's most worse? When Mikey came back from his episodes of treatment, came back home, he found a loving community and bake sales. When my son came home to visit from his episodes of treatment, he didn't find bake sales. He didn't find a loving community. He found silence and contempt. The bad kid. The disease my son struggled with was addiction. When I think back on those years, when Brian was born, he was the child, the son that every father would want. When he was real little, always hugging me, my little buddy, my little companion, always smiling. As he grew a little older, I have such memories of him just playing with his trucks forever in his bedroom, running around the backyard chasing butterflies. But as he got a little older into his teenage years, he tried beer and wine like everybody else his age, or most his age. And for Brian, like about 1 in 10, it was a little different. For some reason, either genetics, which I don't think it was, it could have been, who knows, or he had some anxiety that made him feel better, but for some reason, about 1 in 10 become addicted to that substance. And that's what happened with Brian. Over the next 8 years, he went to 8 different treatment programs, each one different, except for one common element. I now know that none of them treated my son for his disease with any kind of treatment that was based on science. But he tried. I remember visiting him at a treatment program once down in Florida. And I got in really late the night before, and I got up early and walked into his room. To be honest with you, I just wanted to watch him sleep. It was like 7 in the morning. And he surprised me. I mean, if you knew my son, for him to be up at 7 in the morning, which he was, that was a surprise. And he heard me come in, and he looked at me with that big smile of his. And he said, "Dad, don't worry." He was just laying on the bed, flipping through his treatment book. He said, "Don't worry, I got this. I'm going to beat this." But addiction always doesn't work that way. A few years later, I was woken up in the middle of the night by my cell phone ring and told that my son had just died. He was 25 years old, and he hadn't used a substance in 13 months. In fact, I had just been out to visit him to celebrate 1 year of sobriety. But equally worse, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes. Of all day long feeling like an outcast just because he had a disease that caused him to wake up that morning, research suicide notes, write a note of his own, and take his own life. Why are these stories so vastly different? Mikey was a patient, and Brian was an outcast. A couple weeks after Brian passed away, my wife came into our bedroom and found me crying on the bed. And I thanked her. She had framed the serenity prayer and placed it on my nightstand. And I told her the only thing that was keeping me alive was reading that first sentence over and over again. God, give me the serenity to accept what I cannot change. However, as the weeks went on, I began reading and thinking about that second sentence, to being able to change what you can. And I started to focus on two questions. What could I have done differently as a father? And having to accept what I couldn't change, what could be done to spare others? And after 2 months of grieving at home, I took what I thought would be 3 months away from my business, or 3 additional months, and traveled the country, looking for answers to those two questions, meeting with experts all across the country. And when I came back, I took out a piece of paper and I wrote 5 things. Number 1, big. If you had asked me when my son was alive how many fathers in the town of Easton had a son or daughter who was addicted, I would have raised my hand and said, me, maybe another half a dozen. No. I learned addiction was the 3rd largest cause of death in the United States, 3rd behind heart and cancer. 1/4 of American families have someone in their family with a substance use disorder, mother, father, son, or daughter, or more than one. It was big. Then I wrote number 2, children. I had no idea. My vision of addiction was my son when he was struggling in his late teens and 20s. But I found out that 8 out of 10, 80% of those addicted became addicted before they turned 18, before their 18th birthday, when their brains are not fully developed, and we as a society were just letting it happen. Then I wrote number 3, tragic. When I wrote that word, it destroyed me all over again. What I meant by that word was I had learned in that 3 months that our federal government had given out about $20 billion of grants to researchers across the country. And those researchers had successfully used that funding and created a wonderful, wonderful bodies of knowledge. Knowledge that had proven without any doubt, if our communities and our healthcare system and our families did a few things, 20 to 40% of our young adults would ever use drugs and had the potential to become addicted. Almost, call it roughly 1/3. And another body of knowledge that had proven that if certain things were done in treatment programs and in our healthcare system, rates of recovery would be no different than someone recovering from any other chronic illness like heart disease, asthma, diabetes. But I had written the word tragic because all this information was sitting in medical journals, buried and not being used. As a father, it destroyed me. Reading about information that could have saved my son's life, could have, and not just my son, literally hundreds of thousands, if not of others, and improved the lives of millions of others. Yet all this information was sitting there unused. Coming from a background in business, I also crossed out the word tragic and put the word hope. Because now I could see all we had to do was get this information out of the journals and just get it implemented in our society. And then I asked myself, well, why is this? And I put number 4, no national organization. For every major disease in this country, there was one well-funded national organization protecting families from their respective diseases. American Heart Association, Susan Komen, Autism Speaks, Michael J. Fox, American Heart Association, for every major disease except for addiction. And then I asked myself, why is that? And then I wrote shame and stigma, number 5. If I had walked into a church or anywhere 10 years ago and said, I have a charity for addiction, would you donate $1? People would have looked at me like I had six heads. Just throw them in jail. Are you kidding me? But I could see this could change. So seeing this, I could see what our families needed, what our nation needed was an organization like the others for addiction. And it had to start somewhere. So I left my business and have made this my life's cause. And our organization launched in the fall of 2013. As I stand here now talking to you, yeah, I miss my son a lot. And even worse than missing him, it's thinking about what he probably felt the last 5 or 6 years of his life. That shame, that stigma, feeling like an outcast. That kills me. But I can't change it. So we're here to help others. And you're here to learn about it. And join with us if you'd like. Without going through the history, we have 3 main bodies of work that we're focused on. As you can see there, number 1, transforming the treatment system in the United States. So people like Brian will get the same care that Mikey got. Number 2, getting rid of shame and stigma. So people like Brian will be treated like Mikey was. And number 3, educating families with the information that Mikey's parents had that we didn't have. And if we do so and create it systemically, we're not only helping people today, we're changing the system so the whole system changes and the system helps people, not us. So a little bit about each of the things that we're doing. Transforming the treatment system. None of this is that hard. It's hard to do, but it's not hard conceptually. It's pretty basic. Number 1, one national standard of care for the treatment of addiction. So how do we transform the treatment system? Number 1, one national standard of care. Can you imagine for any other disease, heart, cancer, diabetes, there was not one basic way to treat somebody that you learned in medical school? That's the way addiction treatment is. So we looked through all the research, we worked with experts, and we drafted one national standard of care for the treatment of addiction and have gained broad industry acceptance on it. Number 2, a quality measurement system. Gather data and show how each treatment program is delivering on these principles of care, this standard of care. And then if families are only going to the treatment programs that are delivering better care, and insurance companies are using it to build better networks, and states are using it for licensing, and insurance companies are using it for incentive payments for those delivering better care, the whole system changes in addition to helping people today. Number 3, so going back on Holly. Number 3, an addiction treatment needs assessment. Do you need outpatient or do you need residential? And people have no idea. We work with the American Society of Addiction Medicine, and we created one together. It was finished a month before our quality measurement system. We put the 2 together. So families can go there now in 10 states and determine they need outpatient or residential, and then which treatment programs are delivering the right care and which ones are not. 4, payment models. Addiction treatment should be paid for to incentivize and facilitate quality care. We've chosen one payment model to focus on for the last 3 years, how Medicaid pays for addiction treatment to help families that don't have the resources. And there's a payment model that's proven to improve outcomes by 50%. 50% better than if they're not using that payment model. It's paying for a team of 3 people to treat someone versus 3 people individually. When we started, only 14 states had even turned on the billing codes to be able to use it. And now we're over 25 states, and we'll have almost all the entire country done by the end of next year to help the Medicaid population get the right treatment. And the last thing is educating medical professionals. This we're doing nationally versus state by state. We have a bill in Congress now that we've been working on for 3 years. We were gaining momentum. COVID stopped it, and then it started again. It just passed the House by like 300 to 10. It's sitting in the Senate. If we can get this through the Senate and President Biden signs it, it will require every doctor in the country to have a continuing education course in the prevention, treatment, and recovery of addiction. And if we get that done, then every medical school will require it, because who wants to graduate and not be able to practice? So that's transforming addiction treatment. Next, Holly. Here's our national principles of care. It's on our website. I won't go through it now, but if anyone's interested, it's on our website. Next slide, Holly. This is our quality measurement system. It's called Atlas. It's free. It's on our website. It's in 10 states. We're adding 4 more in the next 6 months. One of them is Connecticut. And when we add the other 4 states, we'll be in 14 states, but because they're large, including California, Florida, Pennsylvania, New Jersey, we'll be in 45% of the population by the 3rd quarter of next year. That shows where we are now. It doesn't show 3 states, which is Connecticut, Wisconsin, and Indiana, because they haven't been publicly announced. But when we add those states, we'll be at 45% of the United States population by the middle of next year. And we only launched 2 years ago. It's spreading rapidly because it's such a no-brainer. Next slide. Stigma. To me, this is the foundation of all of it. Think of someone addicted. Well, let me give you some stats first. 75% of the public doesn't think this is a disease. 75% of the public. 50% of the public, 51% of the public is unwilling to have someone who's addicted to substances as a friend, a coworker, or a neighbor. 33% of the public is unwilling to have someone who's addicted to substances who has not used a substance for more than a year as a friend, coworker, or neighbor. I kind of get the first one, the 51%, because it's known to be dangerous. Do you want someone who's actively using as your neighbor? We're going to change that over time, but I kind of understand it. But I don't get the other one. 33% don't want you as a friend, coworker, neighbor, and you're living a normal life, you're not using substances anymore? That's bullshit. Frankly, excuse my language. How is someone supposed to feel? They haven't used a substance in a year, 2 years, 3 years, and they haven't read a survey, but I guarantee you every one of them feels it. And do they then internalize it and believe, I'm not worthy? We can change the treatment system all we want. If you get out of treatment and 1/3 of the public wants nothing to do with you, how are you going to feel? So knowing how important with this, we spent all of 2019 with one of the largest consulting firms in the world, where they did all their consulting for us for free. And we studied all the research. How did our country change its views of marriage equality? You couldn't even join the Boy Scouts if you were gay back when President Clinton was president. And now you can run for president. Well, what worked? What worked? What didn't work? How did our country change its views of HIV/AIDS? What worked? What didn't work? We studied 11 social movements, over 100 pieces of published research, interviews with 50 experts for an hour and a half each, and put together a plan to do so for the stigma of addiction. And it's based on 3 things: educate, change language, and change policies. And we started with one segment, the public, in the state of Pennsylvania. We put together an intervention to educate the people of Pennsylvania about this disease, and in 12 months, we reached 4 million of the 13 million people in the state, and 4 million people changed their views by a third, approximately. a third reduction in stigma. The results were so good, Pennsylvania just extended it for 3 more years, fully funded by the state, and we just picked up 4 new states. We're already working in Kentucky, and we'll be launching in a few months in California, Georgia, and Michigan. And that'll be over 20% of the population in just 1 year. Next, educating our families. 2 ways. We have a program that we put together through employers, and you can distribute it here through the church. It's 6 lessons of 5 minutes each. It's just a way to get it out to people. 6 lessons of 5 minutes each of what every family needs to know, including prevention. It started with J.P. Morgan Chase for all 300,000 of their United States employees. And now it's in 70 employers, including the state of Pennsylvania for all their employees, including the city of New York for all their city employees. And it's now convertible to Spanish. And you can see all our partners down there. Also our website. We have great information on our website. About 400,000 people will go to our website this section of our website this year and learn about this disease, either prevent or treat or recover. And that 400,000 needs to be 4 million, and that's where it needs to go to. But we'll take 400,000 this year. And we have our walks. Just like with heart, cancer, diabetes, I always wonder, did my son, who happened to live in LA before he died, did he happen to turn on the 10 o'clock news one night and say, wow, they're doing a big walk downtown LA for heart disease this month? And then did he happen to look at his Facebook feed 2 or 3 or 4 weeks later and said, wow, they're doing a bike ride downtown 20 miles to raise money for autism. They don't do that for addiction. We're not worth it. Did he ever feel that? Think that? I don't know. Could have. So we launched walks. 7 major cities 5 years ago, did it for 2 years, stopped for COVID, and brought them back this year. 7 major markets. In fact, we have one in New York coming up a week from Saturday. No, this coming Saturday, excuse me. This coming Saturday morning. It's bringing people together. When we stand there at the beginning, and we look out at 1,000 people or 2,000 people, and say, for those of you in recovery, look around. Have you ever been in a crowd here where you have 1,500 people looking at you and saying, we support you, we empathize, we sympathize, and we think you have a disease? And you know what? Not just the people here. Look at the banners. J.P. Morgan Chase, Morgan Stanley, on, Goldman Sachs. Major companies are here to say, we believe you have a disease and we're here to support you. So that's our walks. And anybody here that wants to come, we have information right out there with some flyers. We also have an ambassador program. It's super volunteers. People that want to get trained a little bit and coached. If you want to be on TV, on a local TV station, you want to go to a public hearing and get a law passed, you want to come to a walk and volunteer, you want to come to an event like this and speak, because I can't be everywhere in the country all the time. Let's get more people speaking all over the country, just like this. That's our ambassador program. Anybody who's interested, we have information on that in the back as well. In closing, I often think about the last time my son came home for a visit, which at the time I didn't know, but it was 4 months before he died. And that was a great weekend, and that last day was the best. Played golf in the morning, I beat him on a 20-foot putt. Family barbecue. And that night, the 2 of us were on the back porch talking. He was talking what he talks about, and he used to talk about incessantly, the New York Giants and Eli Manning. That's all he used to talk about. And then the conversation turned to his recovery. And he looked at me, and with a tear in his eye, he said, Dad, hundreds of years ago, they used to burn women at the stake, at stakes in Massachusetts. because they thought they were witches. And then they learned they weren't, and they stopped. I wish that someday people would realize I'm not a bad person. I'm a good person. And I have a bad disease. Well, that someday was 11 years ago. We're making progress. We certainly made progress in the state of Pennsylvania. We're certainly going to make progress in the 4 other states. But there's so much more to do. And we're going to make progress at this walk in New York City coming this Saturday morning. And every time we bring 1,000 or 2,000 people together, every night like tonight, we're making progress. And it's no longer his wish. It's 40 million Americans' wish and their families. So thank you. Thank you for having me. And I'm certainly here to answer any questions, but thank you. Thank you all. Thank you.
We have a couple of microphones in the audience, so if anybody's got a question for Gary, fire away. Don't be shy. Yep.
Yes, as a father of 2 boys myself, let me first say that my condolences. I couldn't fathom what I would do. But I would like to know, what was your first step after you decided that laws needed to be changed? What was your first?
That laws need to be changed?
Yes, as far as
sure.
Addiction.
First of all, what's your first name?
Ned.
Ned. The first step was to do research and determine what laws needed to be changed, and then go through. First, it was federal versus state. As a new organization, we had to create track record. So federal, obviously, if you get something federal like the law we have in Congress now, it changes the whole country with one signature. But it could take 5, 6, 7, 10 years to get a federal law passed. And so as a new organization, I needed to show donors, you give us money and we're going to make stuff happen. So I needed to show results. And so we looked at state policy. When I looked at state policy, we made a list of all the possible laws that we thought can really make a difference, and we narrowed it down to 2 that had some momentum. They'd started. There was another organization that had a few of them passed, so it wasn't impossible starting from scratch, but it was going to be hard because I don't want to do anything just to create a track record if it was going to happen without us. So we picked 2. One was Good Samaritan laws. And for those of you who don't know, a Good Samaritan law is 20 of us are in a room, popping pills, drinking wine, whatever we're doing, and somebody drops to the ground. Are you going to call for an ambulance? Maybe at our age we all would, but if you're teenagers, you're probably going to think, if we call an ambulance, the police are going to come. Joey, who's on the ground not breathing, he'll be okay. And they probably believe that. I don't think anybody would purposely kill anybody. They think, Joey will be okay, let's put a blanket on him, but let's not call an ambulance. And they're kind of biased because they don't want to get everybody arrested. And at that time, there were about 10 states that had passed those laws. But there was not a lot of momentum. I could point to 10 other states. I wasn't pointing to 0, so that was 1. So that was 1. And then the second one was Narcan or naloxone. Who've heard of that? You're lying on the ground, not breathing. You call an ambulance. The ambulance comes. Are they carrying naloxone? If they're not carrying it, you die. And if they are carrying it, sniff it up your nose, you live. But ambulances weren't carrying it. Pharmacists weren't filling it. Doctors were not prescribing it. Why? Because they were all afraid of some kind of liability. So if you pass laws that say, in that state, if a doctor prescribes it, or a pharmacist dispenses it, or if an ambulance driver carries it and administers it, complete protection of anybody suing you. And we got that passed in a number of states. There were only like 6 states that had it passed when we started, and now there's dozens. We got another half a dozen going and created momentum, and then we moved to something else. And we got it passed, actually, in Connecticut.
Other questions? Yes, over there. Matt?
Hi, my name's Matt, and thank you so much. What you've done is ridiculous. You're like a genius. This is unbelievable.
Well, that's not what I've done. I started it, but there's 250,000 people around the country that are part of this. Dozens of states, hundreds of companies, 200,000 people like yourself.
It's unbelievable.
Yeah, I can create a framework, but people join in. People do all the work.
I'm really interested in the standard of care that you were talking about, and I think just like you were saying, just getting the message out about addiction being a disease. I just imagine that alone must be a hard case to make sometimes. I think that still is an idea that it's a choice or it's something other than a disease. And then building that standard of care, I was just wondering, how you've managed and what kind of success you're seeing in that standard of care being implemented.
Sure. Once we had put together the standard of care, the next question was, we had a good draft of it, and I worked with the leading researcher who wrote the Surgeon General's report in 2016 that was based on 3 decades of research. So it was absolutely defendable. It wasn't what I thought. It was pulling a word, a comment, a thought out of that Surgeon General's report in 2016, working with him, and we drafted it. So then the next question was, how do we get this implemented across the country? Who do we need to get to agree to it? So I looked at the data. 25% of addiction treatment is paid for by Medicaid. Okay, I need 50 state Medicaid officers in a room. 20% is paid for by states. All right, I need the head of addiction, alcohol and drugs of each state. I need 50 of those in a room, so that's 100 people. Then there's around 30 large insurers in this country that insure behavioral health. I need those 30 in a room. Then there's another 20 researchers probably that are well known in the country, so that's another 20 people. All right, so I need 150 people in a room to agree on our draft and play with it and all agree to it. Basically, I said, screw this. I don't want 150 people in a room. It's going to take years, and they're all going to argue, and they're never going to agree. Who's most important? The 6 largest health insurers related to behavioral health. If I get them to agree, and they pay for it, screw everybody else. It's just going to happen. Excuse my language again. Sorry. So that's what we did. We got the 6 largest. The chief medical officers, the 6 largest health insurers in the country in a room. And I presented them a simple concept. You're all deciding what the standard of care is your own way, and it's not working. If you all could compromise on one national standard of care, the 6 of you, and then we can get the funding to build a quality measurement system where we gather data and determine how each treatment program is delivering on it, in a few states to see if it works, the whole system changes. And they agreed. So we were able to get the 6 in a room. We presented our draft. They tweaked it for the next couple months. We finalized it. We picked up 10 more insurers company within a few weeks. And we had 16 large insurers in this country signing on to the standard. And now it's become the standard. I mean, I'm so thrilled because literally the 3rd largest insurance company in the United States called us 3 weeks ago and said they want to use our data in the states that we're in to pay treatment programs who are delivering more of these, more money. Instead of getting $1, they get $1.20. And we just got a call today from the largest insurance company in the United States to say they want to do it with us. So this is not putting somebody on the moon. This is blocking and tackling. Basics. But it's working.
Pastor Williams asked before our meeting tonight what Shalom ministry was. And I said that we came up with Shalom because we had realized that our response to people in need across the mental health spectrum, including addiction, could no longer be episodic. Something bad happens, we focus on it for a couple of weeks, then we move on to something else. And that we needed to make this front and center in the life and ministry of our church. So my question for you, you've been at this now for 11 years, so you learned early on, this is not episodic. I've got to jump into this, I've got to stay motivated. So what has kept you motivated and the people that work with you motivated to make this your life's work and not give up when you run into red tape and bureaucracy and all that sort of thing?
That's a great question. It's all of you. It's no longer about my son. It's all the parents I meet who've lost a son who join with us. It's all the people in recovery who are so strong and brave with a difficult disease. That's where I get this from. It started with my son, no question. But it's not my son anymore. It's everybody I meet. It's everybody who joins with us. People like you in an audience tonight listening to this. That's what this is about. This is a gift. I feel blessed to be able to connect hearts with so many people around the country. It's wonderful.
Yes.
Hi.
Thank you so much for coming to speak with our church this morning. It's been very powerful, and I'm extremely appreciative. I'm just thinking that I think the stigma for addiction is really probably the number one reason why a lot of people don't get help. And just wondering what you think can be done, in general about that, and how do you think the schools are doing? Like, my daughters went to Joel Barlow, and I know they had some, education about addiction. I don't really know to what extent, but how do you think the schools are doing in general in terms of educating young adults and students so that hopefully they grow up with
Sure.
knowing that it is a disease and it's not a moral failing? So.
Sure. I'll tell you what can be done and what we've been doing to date, because there's a big gap. We studied, as I mentioned before, we studied this for over a year, all of 2019, and we finished studying it at the middle of 2020 and published a report. Basically what it says this is all based on research and what has worked in the past for other disease states, and now we've proven it works for addiction in the state of Pennsylvania. So what works is three things, as I mentioned: educating, language, and policy change. But education has to be a certain way, otherwise it doesn't work. Imagine the kids in school, Joe Barlow, seeing a 90-second video of, that's probably, let's not say kids let's say people in their 20s see a 90-second video of someone who says, "Hi, I'm Joe. I'm 26 years old. I've been working at Walmart for the last part-time and then full-time for the last 8 years. I've been promoted 3 times. I'm now the night shift manager. I'm married. I have a child. I coach junior soccer on Tuesday afternoons. I have barbecues on the weekends with my friends. And I'm addicted to heroin. But I haven't touched in 5 years. I've been treated successfully with treatment that's based on science. I'm in recovery, and my life is beautiful." That 90-second video has been proven in the state of Pennsylvania to change the way that people think. It's not an image of somebody in the back alley sticking a needle in their arm that you can't be their friend, coworker, or neighbor. It's an image of the tens of millions of people that live in this country who are substance-free, in recovery. Yes, they have an addiction they can't use, so they have a disease, but they haven't used, and they're in recovery, and they're fine. And you can be their neighbor, friend, or coworker. That changes the perception. It works, especially if the one giving the video is someone that they can relate to. It's not someone in Hollywood with 2 million followers. It's someone in their state, in the same demographics that they are. If they live out in farm country, then it's the video is someone in farm country. If they live in a major city, then it's someone who lives in a major city. If they're white collar, blue collar, the video gets served. We have different videos. In the state of Pennsylvania, we have 200 videos, and we geo-target, and we get the videos out to people who are lookalikes, is what we call them. And just intuitively, it works. And not intuitively anymore, it's proof, it works. We did it. 4 million people changed their views by more than a third.
Wow.
So that's called contact-based education. And there's also language change. I can show you a study where there was 200 healthcare professionals in one room, 200 in another, right across the hall. They were told the exact same story. This is healthcare professionals. This is about Johnny, who's an addict. This is about Johnny with a substance use disorder, and he's Johnny. People came out of that room. They were randomly put in the rooms. Let's get people to jail. Out of this room, let's get them to the healthcare system. Language matters. Very few of us in this room, I hardly remember it. Remember the word retard? We don't even remember it anymore. We got rid of it. That's the way addicts should go. People should, the word addict, think about clean and dirty. If you're clean, you're good. If you're not, you're dirty. No, you get a positive drug test, a negative, just like any other disease. Those words make a difference. And then policy changes. Can someone rent an apartment if they have a substance use disorder misdemeanor on their record? Are they going to get health care just like anybody else? On and on. The policies. Can you get a week off of work like you could if you had some other disease? All these are policies. It's educating, language, and policies. And then we have 6 sectors of society that should implement those. Large employers, or any employer, but start with the large and let it trickle down. States, through the citizenry. The citizenry through states is a channel, but it's public. It's the healthcare system. It's criminal justice system. It's media entertainment. And employer. There's a 6th there. I forget which one I missed out. But there's 6. And if we can get that content into each of the 6 and have them implement, it'll happen. There's no if, it'll happen. And the answer, so we've already started in the public with the state of Pennsylvania. Now we're going to 5 states. We just got a $5.5 million grant just a few months ago from Anthem Foundation, the healthcare insurer, to educate healthcare professionals, 3,000 healthcare professionals in 10 different cities that are all serving those that have been historically marginalized, poor people. And so we're going to change not only the way healthcare professionals think about this disease, but for marginalized populations on top of it. It's a 2-for-1.
Thank you.
But that's just a start. That is just a bare minimum. The fact you're all here is a little bit of a start, but it's a bare minimum. For schools, we haven't touched them yet. We just haven't got there. And to be honest with you, we have an education program, I mentioned it earlier on the slides, called Just 5. It's 6 lessons of 5 minutes each. We've tried to get that into schools, and you get resistance because the PTAs, the school the principal's got to go to the superintendent's got to go to the PTA. It just hasn't happened. We're getting it through employers. We have 70 companies now, or 70 employers doing it. We've had a hard time getting it into schools. But if somebody in this room wants to volunteer to get our Just 5 into a local school system here, we'll give it to you. That's what we need ambassadors for.
There's our marching orders for tonight. One last question? Yes.
Hi. Thanks, Gary, for being here and saying yes to our invitation. I wanted to find out, what education is going on with law enforcement, because I do think there's the stigma of addiction with the legal consequences, and also when families have to reach out to law enforcement to help them with their addicted loved one or a mental health issue. How is that education going with law enforcement?
Yeah, that's one of those systems I mentioned, the criminal justice system, and nothing yet. We just can't get there yet. Can't do everything at once. We just haven't gotten there, and there is nobody else doing this stuff but us. I mean, the DEA is doing some, and the DEA is focused on it, but not a lot. There's work to do.
Go ahead.
Thank you so much for this evening. I have a 17-year-old son at home who I will hug tighter and longer when I get home this evening after listening to you. For those of us raising teenagers and working with teenagers, you mentioned prevention a couple of times. Could you talk to us a little bit about what your organization has discovered works in prevention?
Sure. A couple things. I was just looking through my son's photo album the other day and saw a picture of him with his DARE shirt on, smiling. I could tell you DARE doesn't work. First of all, my information on prevention is about 10 years old. I spent all of 2012 building a business plan on studying everything. And I know back in 2012, I knew about as much about prevention as anybody in this country. And there is great science out there back in 2012 about if you do these things in your community, 20 to 40% less of the kids will use drugs. And there's a lot of prevention programs you can put in a community that it's not about educating about drugs. Because again, that age group, the back of the brain, which is risk-taking, is fully formed, and the front of the brain, which is logic, is not. And educating kids about drugs is not going to help. In fact, it's been proven in some cases to be worse because they want to take risks. They wouldn't take risks, they'd never leave home. They always crawl, you never walk. So it's not DARE doesn't work. I can show you studies again. This is back from 2012, but I suspect not much has changed. They don't work. It doesn't work. What works is a program about raising its resistance. It's resistance. It's raising children that are healthy. I'm forgetting the right. What's the word? Resilient. It's raising resilient children. And not only does it result in less drug use, it's less mental health issues, it is more going to college, better grades, more adjusted, the whole thing. And now I haven't studied this in 10 years because we launched and focused on policy, treatment, stigma, etc. But if you're interested, just give me your email address and we can send you all that science from 10 years ago. I don't know how current it still is. The kids change and things change fast, and I don't know what's been happening in the prevention space since. But Holly, we can also get out Just 5. There's a lesson, the demo, Just 5/demo, and there's a lesson on prevention, and there's information on our website.
We began an hour ago talking about stigma. We've talked about stigma several times during the course of the evening. And when we've spoken with our Pivot House friends through the years, they've often highlighted that that's the biggest obstacle. They go through the treatment program. It's a successful treatment program. They're ready to go back to families. They're ready to be reintroduced as income producers and tax-paying citizens and all the rest. But because of the stigma, there's a lot of places that won't hire them. A lot of people that won't rent to them. And so, what you said to us tonight about us being a part of that whole team of people to change the language, to change the perception, to change the talk, to get rid of the stigma. And, we're trying to do that with every aspect of mental health. We're trying to do that with regard to what you've talked with us tonight. So thank you very, very much. What a blessing to be with you.
The way you do it is just to get out, right? We have a big walk in New York City, and you want to come to that, great. If you want to do a community walk next spring, here in Fairfield County somewhere, where it's not a big event with thousands of people, it could be a small event with hundreds of people. But that spreads. That works.
Thank you very much.
Thank you.
We do have a reception in the back room where the conversation can go a little deeper and you'll have more private time with Holly and with Gary. And if Richard, if you're going to be staying around, a chance to pick on your brains as well. But be sure to do that. Our big fundraiser for Shalom is on Saturday, November the 19th from 5 to 9 o'clock on the corner of Verna Hill and Bronson, right? Is it 5? And called Peace of Mind Gathering. And we've got a bunch of deadheads providing the music and online auction coming. So we'll be promoting that very powerfully beginning next Monday, but a lot of it, thanks to the Fultons, is up and running already. Thank you again for a very powerful evening that we won't soon forget. For those of you who are not on the Shalom mailing list, please, before you go, give us your name, hopefully written legibly, your email written legibly, and we'll keep you up to date on next activities. God bless you all. Go eat some food. Thank you, Holly.